Let's speak to the Scottish Conservative spokesperson on health, Dr. Sandesh Gulhane. Good morning to you. I mean, you work in the health service. How bad is it at the moment?
Good morning. It's really bad in the health service right now. I mean, we have to be absolutely clear. Morale is at rock bottom. We are working flat out and have been since COVID. Demand is greatly outstripping anything that we can provide, and there is simply nothing in place for a winter plan. There is simply nothing in place for people suffering from long COVID. There is simply nothing in place for us to see a road to recovery, and Humza Yousaf is failing us, and the nurses as well. They are being forced to take strike action by Humza, simply not listening to them.
Should nurses be given a 15% pay rise?
We need to find an affordable pay settlement, but let's be honest, let's be absolutely clear. It isn't just money. And money is very important. Let's be clear. Money is important. You've got to pay your bills, you've got to pay a mortgage. But 8 in 10 nurses said their last shift was unsafe, and that compromised patient safety. Think about that. 80% of nurses felt the last shift they did compromised patient care. If you go to work and you feel that you're unsafe working, that the thing you're doing could potentially lead to someone dying, that is not conducive to you continuing to work. You know, if you went to the studio and you felt actually you hadn't got the kit that you needed, you didn't have the support that you needed to do your job, and you got a bad outcome, that wouldn't be acceptable. And it's certainly not acceptable to nurses in health.
You say the pay rises should be affordable. What does that mean exactly?
Well, look, we have to be clear that we live in a world where there is not unlimited money, and I have to be clear about that with the SNP as well.
Well, the Health Secretary Humza Yousaf says there's no money.
Well, I mean, we're talking about SNP economics here. Let me explain what I mean by SNP economics. It's choices. They've not chosen to cut the constitution budget. They've chosen to keep money in their pet projects. Nicola Sturgeon
That's hardly going to pay for the health service, is it?
Well, hold on. Nicola Sturgeon took $5 million from the GP budget and has given that away a cop to grandstand. They've wasted $150 million on ferries. They've wasted $100 million on the Edinburgh sick kids. They've wasted close to £500 million on Gupta Steel. You know, these are SNP choices that they're making. They've privatised rail. I don't know what they've done that for, and that is costing taxpayers money.
Well, where would you
you
advise the Scottish Government finds the extra money now? I mean, even if we accept all the points that you've made, that's all in the past. Where do they find the money now?
Well, what we need to do, ScotRail for a start, we don't need to be paying, the taxpayer doesn't need to be paying money towards ScotRail. That's a ridiculous decision that's been made there. What we also need to do is
don't need to pay money to the railways. The railways need funding.
Railways do need funding, but they don't need to be in public ownership. We don't need to be putting the vast sums of money we are.
How much would that save? Would that solve the nursing crisis? Would that allow us to pay 15%?
There's far more things that we need to be doing. So there's that. We also need to be stopping the pet projects. We need to be stopping going through what is a divisive potential referendum, which is going to be a pretendy ref anyway. So we need to stop doing that. We need to take money away from the constitution budget. We need to stop the wasteful money that we've got, where we're spending money on embassies around the world. Why do we have embassies?
Right,
That's not a resolved nation.
You're pointing out all these failings that you see on the part of the Scottish Government. Don't you take any responsibility for the UK Government's failings in all of this? Failing to bring inflation under control, making the cost of living crisis worse, that failed mini budget. I mean, a lot of the problems here stem from Westminster.
Well, so that's an SNP narrative that you've just said there. So let's be absolutely clear what we've seen. We've seen the most money ever given to Scotland in the block grant. We have got £2,205 more per person lives in Scotland than anywhere else in the United Kingdom in our budget. We have Rishi Sunak, who has got the gilt markets under control, who's brought the interest rates back, who's got ourselves in a position where the markets now trust us. We've also got Rishi Sunak, who's given us money towards the energy crisis. We've got money coming into the most vulnerable. We are looking at the budget coming up where we're trying to protect the most vulnerable in society. And we are also looking at inflation, which the SNP love to say, just as you have, that this is Tory, but actually it's a world inflation. And if you look at England if you look at the United Kingdom, in comparison, to Europe, we're not that bad. There's a lot worse out there. So we're not that bad. And we are beginning to work on getting that under control. And you've got to be clear that Rishi Sunak is doing that, and we have gone in the right direction. So as much as the SNP want to parrot out this fantasy, it's not true.
But given that the NHS in England is facing very similar pressures, the government at Westminster isn't able to give nurses a 15% pay rise either. This is a UK-wide problem. You're playing politics with this.
Well, let's have a look at what the nursing union is doing in England. So only about half of areas in England are looking at strikes. This is not playing politics. This is really important. We need to be making sure that patients are safe. Just because the nurses are striking, we're talking about the nurses striking, it's actually, they're striking because of patient safety. They're striking because they do not feel they can provide patients a safe environment. They do not feel that their registration is safe when they go to work because of the extreme pressures the SNP are asking them to work under. That is really at the heart of why nurses are striking. And it's overwhelming across Scotland, across all health boards in Scotland, which is not anywhere else in the United Kingdom. It's clear. We have 6,000 nursing vacancies. We have an unsafe working practice. We have record numbers of vacancies for doctors, record numbers of vacancies for nurses. It is not safe in the health service. For all your listeners who've got to go and they're getting the care from the fantastic staff, this is despite what the SNP are doing, not because of.
Dr. Sandesh Gulhane, Scottish Conservatives health spokesperson, thanks so much indeed.